Alumni Conclave. This program is conducted by our esteemed university. We all take different paths in life, but no matter where we go, we take a little of each other everywhere. I welcome you all once again for the fourth day of MGR Alumni Conclave on title Progen and Foresight in Dentistry. Now I request Dr. Ainston sir, Principal of Thai Mogamike Dental College and Hospital, to deliver the welcome address.
Thank you, Dr. Vidya. Very good morning, everyone. I welcome everyone to this amazing record-making event being organized by Dr. MGR Alumni Association under the aegis of a prestigious university. Firstly, I begin with acknowledging our Founder Chancellor, President, and Secretary for their vision and guidance. I welcome our Vice Chancellor, Madam, our Provost, Rector, and Registrar for seeding and nourishing this 25-day alumni event. A big welcome goes out to all our wonderful alumni who are making us proud across the globe. This is your event. Today is possible because of you. Welcome everyone back to your alma mater. On behalf of our institution, Thai Mogamike Dental College, I welcome our 6-star alumni, Dr. Shakil, Dr. Ramya, Dr. Surojit, Dr. Arvind, Dr. Aisha, and Dr. Mumta, who are going to enlighten us with this conclave on Progen and Foresight in Dentistry. I welcome all our staff members and our students who are the reason for all our success. I welcome all the delegates of today's Alumni Conclave attending the program over Zoom platform and the YouTube. I hope today's conclave of a proud alumni will be an unforgettable moment for all of us and will be a lasting learning experience. And we hope to meet and make more pleasant moments with all our alumni in the future. Thank you. Over to you, Dr. Vidya.
Thank you, sir. Now I request Dr. S. Geeta Lakshmi ma'am, Vice Chancellor of Dr. MGR Education and Research Institute University, to give the felicitation address. Over to you, ma'am.
Thank you for inviting me for this Progen conclave for the alumni meet for the 25 days and the events 25 days with 25 events in each faculty by the MGR Education and Research Institute under the guidance of our management, Mr. A.C. Shanmugam, President ACS Arun Kumar, which has been happening for past few days. And the team which has been behind it, I should congratulate them. This Progen with the newer techniques in the future really would, with the alumni partaking in this conclave, will definitely throw light on the future of dentistry practice. How would it be and what it will be, and the newer techniques which has to be adopted through various digital handling will be enlightened during the process of today's conclave. I wish all the best for this conclave. Thank you, one and all.
Thank you, ma'am. I request Dr. L. Ramesh sir, Joint Register of Events and Publication, to talk about MGR Alumni Association. Over to you, sir.
Thank you. Very warm welcome all the participants, alumni. Warm welcome all the participants, alumni, and other participants. It was very wonderful. Very good morning to all, and congratulations for our dental college as a part of our world record event. 25 days, 25 departments, 25,000 participants connecting the alumni and the present students. That is what actually the key motto behind this. So all our the present students to be connected with the alumni. So maybe 4 or 5 alumni are connected together. So keeping in this mind, we started and we got very good feedback from the alumni. So this is there is a repeated call we received from the alumni stating that they want to participate in the conclave. So it shows that yes, we are going in the right way. Thank you for inviting me to brief on the MGR Alumni Association. So Dr. MGR Alumni Association, it is now a registered society under Society Act in India. It is like like professional society, we are now registered society. So so detailed essence which I would like to know, because most of the present students tomorrow they are become the alumni, so that I need to give little essence that Ma Alumni Association works with the motto of stay, connect, to share and care. I would like to communicate the outcome of Dr. MGR Alumni Association. It is registered as Dr. MGR Educational and Research Institute Alumni Association, and it is called as Dr. MGR Alumni Association. In short, it is called as MAA, M-A-A. So we have around 5 international alumni network. So 5 international alumni network we have, and 7 national network. So what is the objective behind this national network and international network? For example, we have the Bangalore network. We connected the alumni near the Bangalore and form a group, and there is one chairman is there to taking care of that. Like that, we have a European network. We have a Asia Pacific network. Like that, we have a network connecting our MGR alumni, and we are bridging this alumni with our present students. So this is one part we are successfully doing and getting very good feedback from the present students. So next part, we have 2 alumni portal. One is Alumma Connect. We have around 20,000 alumni which is connected there, and we have our own. Alumma Connect is we have a tie-up with the organization that Alumma Connect is there. We have our own portal, Ma Connect. We started just 1 year back, and around 3,000-4,000 members are connected in Ma Connect. So so totally around 26,000 alumni are connected with us. Around 160 abroad students and 200 national students benefited through our office services. What is mean by services? Maybe tomorrow you will be in the abroad, US or UK. You want to get a consolidated mark sheet. You want to get a sign from the registered. Yes, our office is supporting them. So Ma has organized 3 Silver Jubilee reunion and 4 decennial reunion till date. So Ma has executed 75 university level alumni events and 400 department level alumni events. So this outcome for last 3-4 years. So this is what little essence I would like to share you. So we have a lot of connectivity. Last 5 years we traveled in a big way to connect all the alumni. So hope we have already appreciate the dental college already conducted 2-3 alumni meet, and last 1 month they are executing PG level alumni meet also. So congratulate all the principal and the whole team. So thank you so much for inviting me. I will like to proceed for the next. Thank you.
Thank you, sir. I request Dr. Manju ma'am, Alumni Coordinator of Thai Mugamage Dental College and Hospital, to talk about MGR Alumni Conclave.
A very good morning to one and all present here. It's a great pleasure to be a part of this MGR Alumni Conclave 2021. It's conducted by our esteemed university by 25 departments for 25 days with the participation of 25,000 participants. This is the 4th day conducted by Thai Mugamage Dental College with the title of Progen and Foresight in Dentistry, which means a future plan in dentistry for the present generation. Our eminent speakers will give their experience and share their knowledge, which will be an informative session for the participants, that is the students. Thank you.
Thank you, ma'am. I call upon Ms. Abhirami Vedrichelvan, topper of batch 2019-20, to introduce the moderators for today's session.
Thank you, ma'am. Greetings to one and all present. I deem this honor to introduce our moderator for today, Dr. A.M. Shakil, who is an alumni of Thai Mugamage Dental College and Hospital. He completed his undergraduation and post-graduation in the specialty of oral and maxillofacial surgery from Dr. MGR Educational and Research Institute. Further, he pursued a comprehensive training program in the Department of Surgical Oncology in Rajiv Gandhi Government General Hospital for a period of 1 year. He has also attended several workshops and symposiums on implantology, facial aesthetics, and cosmetology to his credit. His areas of expertise include reconstruction after ablative surgery, trauma management, and basal implantology for dental rehabilitation. He has been a successful private practitioner for more than 15 years now. We welcome you, sir, and over to you, sir.
Thank you, Abhinami, for that wonderful introduction. Good morning to everybody, dear participants, audience, staffs, and teachers. Greetings to you all on behalf of Thai Mugambike Dental College and Hospital, a unit of Dr. MGR Educational Research Institute, Madurai, Chennai. We are happy to invite you all for this event on MGR Alumni Conclave 2021. This conclave is unique by itself, as it covers 25 days, 25 departments, 25 conclaves with over 25,000 audience, with the aim of attempting the World Book of Records. Topic today, my distinguished panelists will speak and discuss is Progen and Foresight in dentistry. I have 5 energetic, enthusiastic panelists who will speak on this topic, and I'm sure it will be enlightening for all other students as well as other members of the society. Okay, let me allow me to introduce the first speaker or the panelist today, Dr. Mumta Singharam. Dr. Mumta Singharam from Chennai is an oral and maxillofacial surgeon. She obtained her bachelor's in dental surgery from Thai Mugambike Dental College. She completed a master's in oral and maxillofacial surgery from Thai Mugambike Dental College as well, a unit of Dr. MGR Educational and Research Institute. She is a batch topper in her final MDS exam. She secured All India second rank in fellowship exam conducted by the Association of Oral and Maxillofacial Surgeons of India in 2021 and is currently pursuing a fellowship in craniofacial trauma at Savita Hospital, Tandalam. She has 3 international publications and 2 national publications to her credit. She has won many best paper and poster award in various scientific conferences and symposiums she has attended. She has special interest in craniofacial trauma and has undergone advanced training in AO principal courses in craniomaxillofacial trauma and reconstruction. I'm happy to welcome the energetic and talented Dr. Mumta Singharam. Please share your thoughts on your journey into dentistry. Dr. Mumta Singharam, please.
Thank you, Dr. Shakira. It is really a very happy moment for me. I thank my college, Dr. MGR University in Thai Mugambike Dental College, for offering this wonderful opportunity to me to speak on Progen and Foresight in dentistry. So, a path into dentistry is something that doesn't happen by just dreaming. It has to be a blessing, in fact. So I do not know if I was fortunate or unfortunate to land upon a tooth decay in my 12th standard. And I had to go to a dentist. And he was one of our HODs from the Department of Periodontics in Thai Mugambike Dental College. So he was the one who gave me an kind of a vision, asking like, why don't you join dentistry? So every student who passed 12th standard with this bio group would know like there was only one particular chapter of dentistry just talking about root canal. So we never had a very big vision about dentistry. But after entering and getting to know about dentistry, it is a field which is really huge. There is no end for it. It is a field which has no limits. So that is how I came into dentistry. So I joined BDS in Thai Mugambike Dental College in the year 2011. So once I joined, I was put through various features I had to study anatomy, physiology, and everything, which I thought only an MBBS graduate would study. MBBS are allowed to do that, and we are only focused on tooth. So as a dental graduate, I myself had a different opinion about dentistry. And later when we went in and explored, oh my God, the field is really huge. And it was not a very easy game, definitely not an easy game. But the departments in my college, Thai Mugambike Dental College, they put us through various trainings. They brought the best out of us. So I wanted to pursue MDS, so Masters in Dental Surgery further, because I was introduced to the Department of Oral Surgery when in first year. So it is not possible at all for any first year BDS student to enter a department, a specialization department, and have a conversation with their professors. So it was such a day where they conducted a CDE program on craniofacial surgeries, meaning like there are children with syndromes. So a syndromic child has to be operated to improvise its milestones in development, that it has to get a better learning and for a better quality of life. So the surgeries that were performed were displayed on our in our auditorium, and I was amazed. I was really thrilled to see why are we looking at all these here. And that is when I went and I had a personal conversation. Dr. Kamal Kannadasan sir, our previous HOD of oral and maxillofacial surgery department, I asked him, sir, why are we looking at all these surgeries? And he gave me a vision like, Amma, you can do this too. I was really amazed. Sir, how can a dentist perform all these? And that is when my perspective of dentistry changed. So we had a specialty called oral and maxillofacial surgery, where we are allowed to perform such surgeries and improve the quality of life. And that is where it sparked me, like, I should not stop with this and go further into the field. And once I completed my undergraduation, it was a 4-year course with 1 year of internship. It was really hard, but it was fun. It was really fun. And once we completed it, I didn't stop. So there came this NEET. So we were the first batch to go through NEET and enter masters. So when we did that, it was very confusing. We didn't know what, it again came back to the same point. What next? How do we proceed? What is the procedure to, join masters and everything? So once we entered that, again, I came to my alma mater because I didn't know where else to go. This was the only place where networking was at its best. So when I came and when I spoke to them, they gave me variety of choices. They told me, like, whatever you want to do, you can go through like this. So the guidance from my alma mater was amazing, that it made me become a craniofacial fellow right now. And when I came in, I stepped into oral and maxillofacial surgery department. And I really have to thank my faculty there, each and everyone, starting from my HOD sir, Dr. Pradeep Christopher sir, and Dr. Sendil sir is the one who guided me to get inside this. And he said, like, Mumta, ninga surgery pannalam. I was like, sir, nana. So the confidence, the amount of confidence, the power boost that was fed into me is something really, I never just can't explain it by words. And once I got into MDS, so that is where the training started. There were so many other options too, other colleges that I could have opted for. But something about dentistry is you are going to learn the same thing everywhere. It is just your perseverance and your concept of actually implementing it in anywhere, wherever you are. So you have to choose the right amount of materials that you have with you and bring the best in you. So it is not that only certain centers will give you the best. It is never like that. It is what you have. It is all in here. So you have to implement it. So I did that. And my publications and everything, as Dr. Shakil sir told, it was all because of the constant support that I got from my institution. So it was the motivation my professors gave, like, why don't you publish? So when we came through all that, we at that moment as a student, everybody were going through so much of pressure. We thought, like, yo, how many work should I do? Like that. But the amount of guidance that they gave us is why I'm here right now. And talking about fellowship, so how I entered fellowship, it was again by my professors. They were the one who told me that so once you enter into a specialty, you will have your own organizations, you have your own associations. Like for any special field, there'll be a complete association supporting the latest recent advancements, the happenings, everything will be updated. So in that surgery, we have Association of Oral and Maxillofacial Surgery India. So they conduct fellowship programs. Fellowship programs are something like, it is a super specialty. You get to enhance your hands-on training. So you train better there. It is not like, don't we get trained during MDS? It is never like that. It is just the number of cases, the number of variety of cases per se, because the locations matter and everything. Our college was right in the center of the city. So we had a beautiful exposure there because we faced the day-to-day city kind of a life. So I'm a person from Chennai. So I wanted to know how the patient profile from Chennai would be, and I got that from my college. So now moving little away from the city, now it's a different scenario here. It's more of a rural kind of setup here. So I felt like I needed more exposure, and that is the time where my HOD and my professors told me, like, why don't you apply for the fellowship? We were already going through our master's final exam, but it was the preparation, it was the kind of mindset that was implemented into us that we wrote the exam, we gave the exam. And I'm really proud to say my batchmates, we were 5 total in number, and out of that, all 4 of us are doing fellowships in various fields. And there are 3 rank holders. It was a top 27 list. So from top 27 pan India, like I scored second. My batchmate, my best friend, Dr. Ramya Harika, was 13th, and my another best friend, Dr. Paulin, was 15th. So on the top 27 list, our department of maxillofacial surgery held 3 rank holders pan India. So I needn't emphasize more on this because this is the amount of training and this is the amount of push we get. So dentistry doesn't just stop with DKs or whatever. And then we entered fellowship. So what all we could reach in fellowship or in a thing is, like, we have the various fields. Again, dentistry itself is divided into 9 departments, and then it further proceeded to maxillofacial surgery. From there, we again get to a variety of 7 departments. We have cleft and craniofacial surgeries. So cleft is something like the child is born with a split lip or a split palate. So we are eligible and we can operate on them. Second thing is oral cancer. It is one of the hugest problems that is facing in India. So India is facing that. And as an oral and maxillofacial surgeon, we are eligible to perform resection of oral cancers and also reconstruction, as Dr. Shakil is one among them right now. Also, we have cosmetics. That is something really huge, and I guess my fellow panelists will discuss about cosmetics. And yes, of course, yes, dentists are eligible to do that also. So there are so many things. So main thing is trauma. Trauma is something that we face day-to-day life in our life too, but facial traumas. So jaw, mandible fractures, jaw fractures, mid-face fractures, eye, the front bone, this part. So all these fractures are also repaired and reconstructed and brought back to life by us. So once I got here, it is an immense training. The practice is like wonderful here right now. And the credit all goes to back to my alma mater, because if they are not there, and I don't think I would have this much of confidence to step in and perform. So it was really a wonderful journey, like starting from my BDS through my MDS and coming into fellowship. It was amazing. So dentistry, when the kids these days, the students these days, they come and they ask me, ma'am, do you think dentistry still has scope? I ask them, like, why do you ask such a question? They say, no, it's saturated. So I would like to say one thing for today's generation, today's students, never ask if there is scope in any field. There is always scope until you are there. So you need to create your own space. You need to create your own scope. So do not fear or do not worry about the saturation of the field, because it is one amazing field where there is no limit for you. Like how I started from my dentistry, from my BDS. Yes, we all started with a basic cleaning, then DK filling, root canals, orthodontic treatments, alignments. And now here I am performing craniofacial surgeries, correcting cleft lip and palate. I really feel proud from how I started to where I am. And a very special thanks to definitely to my faculty, who thought I am capable and who told me that you are capable and please proceed. So without that kind of a personal push, I do not think anyone can attain this level. And there is much more for me to further explore into. And I'm really happy that I chose dentistry, because even if I had chosen some simpler field, I would have been constrained only to that. But dentistry is an ocean. You will never find an end to it. You can just keep swimming till you are really tired, and you say it is enough. So in the field or the society is never going to say stop, it is enough. It is you, your soul, that has to be content, and only when you say I'm done, it's done. So it is such a huge field, and I'm really proud. I would thank God and the HOD sir who's retired right now from Taimugambike Peri Department, Dr. Jai Kumar sir. So without you, I do not think I'll really be here. Have to thank my parents too, and my management is really supportive, who again took me in as an MDS candidate and gave me the best. I do not think there would be any other better options. If I had to go back in time, I would never regret my choices, and I'm really proud of that. Thank you so much.
Thank you so much, Dr. Mumta Singharam. It was a wonderful, enlightening, and energetic speech. I would like to call upon Dr. Surajit Datta, my next panelist, and I'll just introduce him. Dr. Surajit Datta from Maharashtra is a prosthodontist and implantologist. He obtained his BDS degree from Raja Muttiah Dental College, Annamalai. He completed his master's from Taimugambike Dental College and Hospital, Dr. MGR Educational and Research Institute. He is a department batch topper in his MDS final exam. He has presented various scientific papers and posters in the conferences he has attended. He has 4 international publications and 2 national publications to his credit. He is currently a senior lecturer in Yashwant Rao Charan Dental College, Ahmednagar, Maharashtra, with over 4.5 years of experience. He is an energetic and successful private practitioner as well. He is a consultant prosthodontist and implantologist in various clinics around Maharashtra. His current interest is to create patient-dentist rapport. He calls it PDR, and to create awareness of dental insurance in order to make dental treatment affordable to all sections of society. Really a noble gesture. I hereby welcome the vibrant Dr. Surajit Datta share his thoughts about his journey into dentistry. Please, Dr. Surajit Datta, your thoughts.
Hello, everybody. This is Dr. Surajit Datta here. First of all, I show my gratitude and thankfulness to Taimugambike College and the university for giving me the opportunity to speak today in front of everybody regarding the college and everything as an alumni. I was really interested. During this lockdown, I missed the college very much because I've gained a lot, and I'm really thankful to the department. Whatever I am today, it's all because of the department and the university, which has provided me all everything today. Starting with my journey as a dentist, I was not born as a dentist actually. Like it was a one-day decision for me to become a dentist. Actually, I was supposed to be born as an engineer rather than a dentist. But somewhere in my heart and my family, especially my dad and mom, they wanted to put me in a medical field because it's a matter of proud try to to be as a doctor like that. So I was selected as an I cracked engineering entrance, and I was in a Manipal University in 2008 with my dad, and I thanked my sister on the morning. On that morning, she called me and she called my dad, and she told me that that there is an opportunity for my brother that there's a BDS seat in Annamalai University in Chittambaram, Tamil Nadu. And that time I was not aware of much about what is BDS and all. My dad explained everything, and I was like, okay, I'll be able to become a doctor. Then, like we flew to Chittambaram, like to Chennai, and then to Chittambaram, where the Raja Muttiah Dental College is there. We addressed the department, and every department is a college. We have seen the college. My dad liked it, and it was blind faith of me on the dad that he will never think anything bad about me. And of course, he's a person who has always supported me like that. I have joined as a PDS like that in the in so-called Chittambaram. Okay? There, like where my real transformation has happened slowly, gradually. When I slowly, like first year, second year, third year, fourth year, like I was a normal student where I was growing, and acquiring knowledge in dentistry. Slowly, the faculty over there showed a lot of interest and cultivated the that yes, you can do something in dentistry. Then at the end, when I was internship, I learned my maximum, especially in Department of Prosthodontics and Conservative. There I was in two minds whether I would join in Prosto or Cons. Like then I had when I left my college, the BDS, I came back to Chennai. I worked for 1 year under Dr. Madhivanan. He's old surgeon HOD in Asan Dental College. Then after working 1 year, I realized that I can even go further. And with the support of my dad, I approached my dad, and my dad told me that yes, you can do it. I'll support you for whatever you want. Then I thought, yes, I should not stop as BDS. I should not stop. I can do even further. I can learn more. I can, project more. I can do much more in my life rather than, ending my life as BDS. Then with my dad and my mom, I visited many colleges over Chennai. Then finally, I somehow, with a God blessing, I just landed over the MGR University over here in Taimugam Dental College, the medical field. Okay, there I just became the dad and mom, like the environment so much, the neatness, the everything, the way of silence. So what my dad observed is the students are leaving the department with utmost silence and discipline. And he's the person, he's the person who can judge like anything. And he told, wow, beautiful. How they are training students is amazing. That there's a pin drop silence of even they leave the class. I still remember my dad told me this. Then I was discussing with him, so what to do. Then he told me, better join this college. I feel this is perfect for you. And then this is how my journey and the real transformation as a human being, as a prosthodontist, has started when I met my maturity Dr. Rai. There, she is a person who has slowly, gradually transformed me into a real human being. And whatever I am there today is because of her and my other staffs in the department, especially Dr. Prabhu and Dr. Betty, Dr. Geeta ma'am, and many more staff, Ishwaran sir, both junior and senior, they have played a lot of role for me to transform into a student into a prosthodontist. Then again, when I started my course as a post graduation, there only the maturity of me has started to evolve slowly, where like I start to understand the real fact of what I am and what I can do in my life and what I should do as a dentist, as a prosthodontist, and the real love for dentistry I got is from the Department of Dental College. Why? The reason is simple: is dedication of the staffs, especially my HOD and everybody over there has dedicatedly and sincerely taught me each and everything. And especially Dr. E.G.R. Solomon, he's not there with us, but definitely I remember him like anything in my life. Whenever it was student, I'm also a staff in dental college. I teach students over here. But whenever I see as a teacher, I remember my teachers because this is how I got taught in time Dental College. This is excellent college. I have never faced any kind of problem regarding whatsoever regarding materials, regarding the cleanliness, regarding the advanced technologies which they offer, and the environment, the comfort they offer to us to work freely in the department and with the utmost, the poshness, the professionalism. I never felt that I am a student or a kind, I'm working. People say over here that once you enter the post graduation, you are a doctor. You are no more a student anymore, like that. And when I had a separate cubicles for me, I have separate slots. I have a like huge thing where I can perform my dental practice in my own way. And as a private, I always believe that I'm working in a private clinic, that environment which has been created by the Time Mugambi Dental College as a postgraduate student. Second, the knowledge they incorporate slowly to the students, and the upliftment is so amazing that I'm the example of it, because whatever I strongly can, I proudly can say that whatever I am is because of the college, especially the postgraduate college that I've done through time Dental College University. Secondly, now once I was third year, I had a conversation with my HOD that after my examination has been done, I met her after the college, and like it was a very wonderful conversation with her. She had where she again as a teacher, she showed me that you can do, just go ahead, you can do further in your life much more than what you are. Have confidence in yourself. And one of the most important thing I want to highlight in the college is that the discipline which we maintain in the college is really, really amazing. The real respect for the staffs. The real once it's, now I'm a teacher, I expect the same from my students. It's like the once the student deliver respect to yourself, the teaching comes from here, right from the heart. There's no, you don't feel anything to teach the students. That's what is important. And what I've learned from the time we got in dental college is work hard. If you have to survive in this tough world of dentistry, you need to work hard. You need to be on your toes. And what this is what I have learned, especially from my guide, that you be disciplined, you work hard, and don't worry for the success, and don't go behind the results. It's an automatic system. You work hard and you deliver your 100%. Your success will be just next to you. You don't have to search anywhere, and people will be knowing that yes, and you definitely understand for anyone that like who is doing hard work and what's what exactly in life. So actual transformation, as I can't have much more, I don't have much words to express, but definitely yes, such Time Mugambika is a college where everybody should join, especially as you know, the post-graduate departments are really amazing, where each of our staffs are really amazing over there, who put their 100% and allow us to learn and teach our maximum. Because I have visited many colleges, like what I feel is really our college is really equipped with a lot of good materials and the technology, such that our growth should not get hampered and we learn our maximum. I miss my college, especially time when I'm going to college, as because I'm very far from Chennai. But really, I want to visit once, probably after the COVID ends. So I will definitely visit. Once I done my this thing post graduation, then I waited for 4 months. So in Chennai, I started to understand that yes, I have a good life in Chennai, but yes, I can do better outside. Why? Because I want to free my dad from all of my expenses, all of the expenses which has been on me. So like I want to earn, I want to stand on myself. Then the great blessing of God, I had an interview. I appeared for an interview in Western South Chawand and the where I am presenting when I'm right now working as senior lecturer. When I came for interview, the authority who recruits people was very impressed with my presentation and the knowledge. So he told me that sir, you can join the college because this is how my a different phase of life has started, right from a student to an academician or as a teacher. In 2017, when I passed out in August 2017, I joined as a staff over here in this esteemed college of Yeshwanto Chawan Dental College, where I started my another period of my life as a teacher. Here, right now, I'm working for the past 4 years as a senior lecturer, and this is also an amazing college. Here, I am guiding the students, both undergraduates and postgraduates. Yeah, again, one more thing I want to mention: the beautiful experience when I came first as an teacher. One of my senior staff on my first day just told me that yeah, there is a final year lecture. I'm a little tired. Can you just take it? I just told him what? I, Today is my first day, sir. Can you please excuse me? I'm not prepared. Then like but inner confidence of me, which the time and my mom has given me insight that like I can do it. I can at least teach an undergraduate student. I'm capable of doing it. There where I realized it, really it's awesome. Then I said yes, sir, I will take it. No problem. The class was 2 o'clock, and 2 o'clock, and he also came surprisingly. I probably as I knew stuff, and I did a chalk and board this thing explanation, and the topic was on fixed fashion dentures and that. And like everybody was really happy with the presentation, and I was very I got a goosebump that day because really I didn't expect, because it was an without preparation, without a PPT, everything was so knowledge of mine which I could deliver to the students, and they were really happy with that. Then I realized that yes, I can do it, and and I can really become a teacher. I can teach students, I can deliver my knowledge, and I can help the society and I can help the students to come further up and acquire knowledge. And right now, like when and again the second phase, which I remember is a day was there when all the staff was not available at this college, like, and then I had to guide my PGs. And then one PG came to me and asked, "Sir, can you help me out in this?" And it was a full mouth rehabilitation case. Then, it was like I have done a lot of cases under the guidance of Dr. Siddharaya, ma'am. But really, it was as a teacher, it was my first experience because of a very big issue. Then I told, okay, fine, I'll guide you. Then I guided him to a very extent. And when my health department has seen the steps which I have told the students, it's like, and he was really happy that yes, because what ethical knowledge and ethical practice I have learned from the college, I could deliver to the students over here. There how I'm like now as a teacher, I am enjoying my part of life. That yes, I'm delivering knowledge. Yes, one more thing. I just wanted to tell something which I must give my BDS and MBS segments to the upcoming students. Which, like I want to say, is see, listen, all of you can upgrade yourself. Should upgrade yourself. Upgrade yourself with a lot of knowledge which is available in the college. How? Where the knowledge, where the treasure is there is the library. You have to go to your dental library. You please read a lot of journals and articles. Textbooks definitely yes give us a lot of knowledge, a lot of information. But the recent advances, when somebody talks about these advances, it's solely available in dental libraries. So I will request you all, please, when you want to stand out in this heavy competition and you want to upgrade yourself, you need to know the recent advances. And for knowing these advances, you just spend time, sit in the library, open journals, open books over there. You have Time Mugambe is having lot of information, lot of access to journals where you can just sit and just acquire a lot of knowledge over there. So what you learn, you slowly polish yourself. Suppose you know a topic, suppose you suppose how to prepare a tooth preparation. But in textbooks tell us the fundamental way of doing preparation. What are the advances which you can acquire in the preparation? You will get in library in the world where people are doing researches, and they are getting it's beautiful that it's a beautifulness of human being that what we learn we try to share with others. That's and now and help others to know easily, just is fingertips. Like how you update your phone, please update yourself. To enjoy the joy of success. To feel proud and to feel good, and that comes with the instinct to love your subject. And I especially thanks the department, the ma'am, the staffs over there who incorporate the love of prosthodontics. And I feel proud because when I go as a consultant, I go as a consultant to many clinics in Pune and Ahmednagar, when even the senior dentist called me as a consultant.
Thank you, Dr. Surajit Datta. It was wonderful hearing all your feelings. So let's get to the next panelist, Dr. Aisha Tabassum, who is the youngest among all the panelists. She is a PG student in oral pathology. She completed a PDS from Mugambi Dental College and Hospital, Dr. MGR Education and Research Institute. She stood second in conservative dentistry in her final exams. She has published one scientific paper and is working on many more. She has attended various conferences, seminars, and symposiums. She stood second in track and field event of inter-college sports meet and has won medal. Her outstanding contribution to the society was participating in the event Say No to Plastics. She has given a lecture in Dr. MGR Medical University about the hazards and harmful effects of the plastics. I hereby welcome the youngest and the energetic speaker, Dr. Aisha Tabassum, to share her thoughts on the journey into dentistry. Welcome, Aisha.
Thank you, sir. Thank you so much. So very good morning to one and all present here. I will start with a quote. Some pains are mental, some pains are physical, but the one that has both is in dental. So let me tell you what inspired me to be in dentistry. So my journey for being a medico started seeing my parents, who are also doctors, and the way they treated the patients with love and the compassion showed me the importance of the medicine. Second, moving on to the dentistry, a general dentist who I visited when I was around 8th to 10th. I still remember his smile and the very polite way of treating me gave a positive impact in dentistry, that I should perform, that is a good option to do the dentistry. And also, to be honest, I fell in love with the dental chairs. So dentistry is the only field which has to have both characteristics. One is artistic. The dentist has to be artist, at the same time he has to have a knowledge in the brain. So it has to be balanced. And I am being a the person who loves art. I liked it. So I was like, okay, then it has both. I don't have to suffer only on the theoretical part. It also has artistic works where I can transform smiles. At the same time, I can cure diseases, cure people pain and conditions. So that one thing was convincing for me. Second was being a sports person in school, thinking about moving on to a college, medical college, gave me a small fear for not being able to continue my sports and my love for dentistry also. So I'm so grateful for the staffs and the teachers I met in this college who have always encouraged me to be good in both. The highlight of the college was the main arena where the traveling was never hard, as it is situated in the hotspot of the Chennai city. And the main part of the ground of the ACS was also paved me a way for my passion. The second thing, in final year of my dentistry, I realized the actual importance and the wide range of options which can explore in dentistry. As first year and second year, we will be reading all the anatomies, subjects, medical subjects theoretically. Only on the final year, I could see all kinds of departments where to treat patients. So then I realized, okay, there is a very good opportunity to continue this because of my constant motivation and having a hope on me that I can pursue masters. So the second thing which inspired me in Thai Mugambike Dental College is they give us a shoulder to shoulder skill teaching. So they never leave you, and student and the teacher relationship was really motivating, and always pushed us to a place where we were able to grow from our box. Third thing was I was introduced to entrepreneurship in the internship. Being a medico, entrepreneurship was kind of new for me, but as my guide, and I really thank my principal for believing in me that I can do research, because I had an interest in doing something different, things differently. So first thing was my sport and medicine, and I love forensic odontology. So forensic odontology gave the seed for research. Then they introduced me to the entrepreneurship, which was available in our college, Dr. MGR University. I pursued that, and that 1 year of internship changed me completely as a person, made me as a better person. I am hopeful and grateful for this college. And most of the time, the teachers are always sculptors to the student. These teachers, not only they sculpt us to be a good dentist, they majorly focused on to be a good human first, so that you can understand the pain of the patients and understand the condition. As Thai Mugambike is situated in the city, we were able to see both economically low patients and the patients who are economically well. So we were able to connect and to work according to it. So that was a good exposure basically. Here in MGR University, I would promise you, not only you will learn dentistry, but also they will offer you to work on passion and improve your talent too. So as I have to talk about a small thing about being a successful person. So though I am not as successful as the word success means, I could share few views about being successful. Success is a very personal word. It has a different meaning to each individual. So I'm not. So first quality a successful person should have, having a thirst to acquire knowledge, believing in hard work, believing in balancing the hard work and smart work is the initial thing that will lead you to a step of successful. Second is acceptance, accepting all your imperfections, your mistakes, and all your flaws, but having the ability and the mindset to correct it and rectify it, to improve yourself. You should not be this is you and you should not complete your mentality at the stage itself. You should have the ability to explore your mind and explore people, so that you will learn. Each and every person you meet is going to give you a life lessons. Third is consistent is the key. No matter how small your act is, do it consistently. It will do wonders in your life, and also it will lead you to a good practitioner. So I sincerely thank you for all inviting me to be a panelist, and I always owe and grateful for joining Taimugambika Dental College. Thank you, sir. Thank you, ma'am.
Thank you very much, Dr. Aisha, for this wonderful speech. Next, I would like to call upon our next younger panelist, Dr. Arvind Chakravarti. He completed his BDS from Taimugambika Dental College and Hospital, Dr. MGR Educational and Research Institute, Chennai. He secured a postgraduate berth in Government Dental College in Punjab, but declined otherwise because after passing his NEET, because he decided to work on short-term courses, like patient wanted to learn short-term courses like patient-specific implants, basic implants, due to his keen interest in implantology. He believes in upbringing the health in urban as well as rural sectors. He has set up his private practice in rural sector to set up an example. He has presented numerous papers and posters in scientific conferences he has attended. His thoughts of understanding patient psychology made him pursue a diploma in psychology to better understand the patient. He is a firm believer in treating the patient as a whole by understanding their psychology. A great approach indeed. He has got a budding entrepreneurship award from Malligai Dental Academy in Chennai. He has also got an award for developing innovative prototype in Dr. MGR EST Newgen IEDC from the Department of Science and Technology, Government of India. He has participated in numerous study and research works. I welcome this enthusiastic Dr. Arvind Chakravarti to share his views on his journey into dentistry. Arvind Chakravarti.
Good morning, one and all present here. I am Dr. Arvind Chakravarti. I am a director, Medical Dental and Cosmetic Correction Center. I would like to share my journey into this dental field. Right from childhood, my dream is to become a surgeon. That's why I joined BDS in Taimugambika Dental College. During my college days, I was an average student, but I was very much interested in the clinical side. That too in surgeries. Seeing blood in my gloves gives me a satisfaction. In my final year, by the guidance of Dr. Pradeep sir, Dr. Ravi sir, and then Dr. Sridevi ma'am, I secured university second rank in Department of Conservative Dentistry. And then by the guidance of Uma ma'am, Snowfia ma'am, Lalita ma'am, Shankar Raman sir, Gopal sir, I secured first rank in Department of Periodontology. After my final year, I was confused about my future, what to do next. And then so many questions I used to ask myself. During my internship, I worked in a private clinic where he runs his own institution, and then he used to conduct so many short-term courses in ortho, endo, perio, implants, etc. As I was working there, I completed some hands-on courses in endo, perio, and implant there itself, where he allowed me to do procedures like root canal in the posterior teeth and then implants on the patient. Only after this, I realized there are so many courses available after BDS. And then the degree is not the matter. The procedure, what we do, and then how we do are more important than the degree. Then I decided to do the extra short-term courses like the advanced rotary endodontics. I did some courses in maxillofacial implantology, and then basal and cortical implantology, and then all on 4, all on 6. And then recently I completed my patient-specific implantology and laser dentistry. In 2018, I attended NEET to MDS 2018. By the constant guidance of all my faculty in Taimugambika Dental College, I secured good marks and I got MDS seat in Government Dental College, Punjab. But I refused taking up that seat because I have a lot of interest in the clinical practice. Then I decided to start my own practice in my hometown, for which I ought to gain some experience. So I decided to work in a reputed clinic in my native place to analyze the patient needs. There I came to realize certain things like the majority of the patient visited dentist with the complaint of pain or with the treatment concerning the aesthetic problem or some aesthetic needs, but they are very less care about their non-aesthetic teeth, like they are not bothering to replace the missing posteriors, and then if they have a pain also, they are not ready to do a root canal treatment to save the teeth, which will help them in the mastication, all because of the cost concern. I came across so many patients where they are willing to pay for the aesthetic treatment, but not for the functional treatment. That made me perceive the importance of looking good in the people's mind. These days, everybody wants to be a good looking and they are ready to spend more money to enhance the beauty by improving their appearance. It is not only helping them in appearance, but also helps in boosting their self-confidence, self-esteem, and then they are overcome their inferiority complex and make them happy with themselves. So I decided to take up an additional cosmetic course along with my dentistry. Then I did some fellowship courses in facial aesthetics, cosmetology, trichology, and semi-permanent makeup. Recently, I completed the hair transplant surgery also from the reputed institution. This is how I plan to combine dentistry with the cosmetology. And then during the pandemic situation, I noticed my friends, relatives are getting frustrated and then depressed. Other than beauty and the physical and mental health, maintaining the sound mind is more essential. For that, from that point, I realized the need to learn people psychology and took up online psychology diploma course. After that, I understood the mental health and physical health are connected one another. There is a saying, a sound mind in a sound body. After that, I become more interested towards psychology that pushed me to do a post-graduation in psychology. Just now, I have completed my master's in psychology from the Alumni University. By then, I started my own practice. Now, the psychology helping me a lot to understand the patient's mind and their needs, expectation. So I handle them accordingly and I make them feel comfortable. I can understand the patient better. Now I can help them with both their dental, cosmetic, and then psychological needs. I believe that once we understand the patient need and their problem, it will be easy to convince and make them understand regarding that problem and give them the possible solutions. Once the patient trusts us, definitely patient will take up the treatment irrespective of the treatment charges. But never ever try to convince the patient for the treatment which you know better and which one you get a more amount. Instead of that, understand the patient needs properly and give them the appropriate solution for their problem. That is the key goal for the successful practice. I believe everyone should possess rudimentary knowledge regarding the mental health and give importance to psychology to help yourself and people around you. Thank you so much for your valuable this opportunity. Thank you, sir.
Thank you so much, Dr. Arvind Chakravarti. It was really a wonderful speech. So I would like to call upon our fifth panelist, Dr. Ramya Harika. Dr. Ramya Harika, an oral and maxillofacial surgeon from Chennai, graduated from Sri Venkateshwara Dental College and Hospital. She completed a master's in oral and maxillofacial surgery from Thaimugami Dental College and Hospital, Dr. MGR Educational Research Institute, Chennai. She has 2 national publications to her credit and is working on many more. She is currently a consultant of oral and maxillofacial surgery at Mehta Hospital Global Campus, Velapanchavadi, Chennai, Gayatri Hospital, Thiruvekkadu, Chennai. She is also a consultant in various clinics around Chennai. Her future objective is to work as a craniofacial surgeon. She has presented various scientific papers and posters in the conferences and symposiums she has attended. She is a department batch topper in a final year exams in MDS oral and maxillofacial surgery. I welcome the young and enthusiastic Dr. Ramya Harika to share her thoughts on a journey into dentistry. Dr. Ramya Harika, please share your thoughts.
Thank you, Dr. Shakil, sir, who has been not only been an excellent senior to us, but also a moderator on this event. And I would also like to thank Dr. Manju ma'am for organizing such a beautiful event, and also Dr. MGR University, our principal, president, and vice chancellor. So greetings to one and all present here. Like sir said, I completed my BDS from another dental college, Venkateshwara Dental College, during which time we did not have PG in our college. So we were the only students, the undergraduates were the only students and we had no idea how a PG life, PG college would be, or PG lifestyle would be, the how the department runs or how the college functions in the presence of postgraduate. So, and we were exploring many options on what to do after BDS, like what most of the audience right now would be wondering. So there are a lot of options. You can continue to do further education like MDS, like how most of us have done. Or there are other options like going abroad also, where you can go to Australia, Canada, or the United States to work there. In the Australia, you would just have to clear the exams, the Australian Dental Council exams, and you can practice as a BDS practitioner there and pursue further studies if you want to. But in terms of Canada or USA, you need to clear the exams, do a dental school there for 2 years, and then you can become a practitioner or pursue further studies. But apart from that, apart from the masters in India, you have various other fellowship courses. Like Dr. Mumta has previously mentioned, we have aesthetic fellowship courses like fellowship in aesthetic medicine and fellowships in root canals, learning endodontics and root canal treatments. There are fellowships in general dentistry and fellowships in implantology. There are international fellowships also like the ICOI, International Congress of Implantology Fellowships, where you get hands-on participation, and you will be able to do treatment, like in place implants in patients, learn practically on how to do. Like I can understand now, because of the pandemic, most of you have a little lesser clinical exposure than it was actually supposed to be, because the colleges were shut down for almost a year. So you need not worry on how to, what to do or how to do, but you can always catch up with a lot of opportunities available outside. There are a lot of centers which offer fellowships. There are a lot of centers which offer further training with hands-on training on patients or models to enhance your knowledge. So after BDS, we, like Dr. Mumta mentioned, we were the first NEET batch. So we had a lot of chaos happening around us. We didn't know what to do, where to join or anything. And neither did I have any idea on, which college to join. But I was sure I wanted to do oral surgery because of my exposure to surgery was right from my UG third year. So I started going to cases, and also I know how maxillofacial surgery was. I had an idea of it. But little did I know on which college to join, which would offer me the better course or the better learning experience. So that's when I contacted my circle and got to know Dr. Pradeep Christopher sir, who is the HOD of the oral surgery department. And I should mention this, that he was the most approachable and down to earth HOD, I would say, because I never thought, approaching the head of the department would be such an easy and comfortable way. He was very approachable. He helped me through the process. He guided me. He was there and present in person at the MGR University, the ACS Medical College, to help me through the joining process. So he explained to me about the college and all. And I met another Dr. Ashwin at the counseling at Omandurar College, where the counseling was happening. And I met another Dr. Tamalini, who was co-PG in oral medicine. Those two actually gave me an insight of what the college would be, how, because she was an alumni, she was an alma mater of Thai Mugamge. She did her BDS in Thai Mugamge as well. So she gave me an insight on what the college would be. So knowing from a peer and another faculty from the department, as well as the HOD coming down himself for helping me through the process of admission, it made me feel very comfortable and a little confident to join in Thai Mugamge College. And MBS journey, needless to mention, it was tough. It took a lot of toll as well, but it was worth all the efforts. So all the faculty, starting from our senior lecturers, our tutors, to the head of the department, everyone was approachable. We were encouraged. We were never put down or let down. You can't do this, or this is a tough job, or anything like that. We participated in everything, all the conferences the association has conducted. We even went to do our in competitions like performing sagittal split osteotomy, one which we do in patients. We were allowed to go and perform those in the conferences as a competition. We were allowed to present all the papers. We were asked to go and attend all the conferences, all the lectures, workshops, and allowed to do the best in patient care as well. And I could proudly say that we have the best hands-on patient care, like all the procedures which we do in the college as an oral maxillofacial surgery PG. I can say that compared to any other college in Tamil Nadu, we are given the best hands-on. We operated on patients much more than any of our other co-PGs from other colleges would have done. So that is a big plus, because that's what gives us the confidence. Now, as a consultant, as a practitioner, if I go and practice outside, that is what gives me the confidence that yes, I have done this procedure before, so I can go and do it. I can attend this. So that is what gives us the confidence in taking the next step. And like Dr. Mumta mentioned previously, you know, all three of us, me, myself, Dr. Mumta, and Dr. Pauline, we secured national rank in the association conducted fellowship exam. So this is not a small thing. Might sound like, okay, fine, what, she gets a national rank, she gets a national. So all three got national rank, means that must be an easy task. No, it is definitely not. And we did not undergo any special training to attend the exam. But the way our department has trained us, our professors, Dr. Sendal sir, Dr. Vanna ma'am, Pradeep Christopher sir, Srivatsa sir, everyone took their effort in training us in such a way that the fellowship exam was easy to us. It is not that the exam was easy, like everyone could get some rank or anything like that, because in all over Tamil Nadu, the Chennai colleges, only we three got the ranks in the Chennai colleges. No other college PG has secured that rank, which we were actually, surprised that, okay, so our training has been such a way that we were able to secure a rank easily compared to the other colleges. So that is what I would like to emphasize about Thaimugambage Dental College. It is not that you are, you have to do the fellowship, you focus, study specially for that. No, our training was in a comprehensive way that we were theoretically sound as well as practically. Both our skills were nurtured beautifully and to the best way by our department especially. And also I would like to thank the management also, who was considerable in the difficulties at any point we encounter in terms of fees or in terms of any facilities. We were given the liberty to approach the management as well. So yeah, for anyone who's thinking of doing post-graduation, I would surely recommend them to go for your skill, choose the subject or the department which you like. Go with your passion, not just because someone is doing maxillofacial surgery and is a practitioner or is very successful, take that, or a prosto or any department for that matter. Choose with your passion, see what you're successful in. You can go and visit the department or the center which you're going a little prior to it, and go visit the center, have a talk with the fellows or have a talk with the postgraduates and the staff there, inquire about it, and then join in whatever you're doing, but pursue it with all your heart. And I would definitely recommend joining the surgery department of Thaimugambage Dental College as an alma mater. Yeah, I would give it a full thumbs up. You can go and join. Every staff in the department is very, very, very approachable, which is the rarest thing you will find, especially for a surgery department in any college. So yes, and I would like to thank the institution for giving me an opportunity to come back here and share my insights as an alumni on this day. Thank you.
Thank you very much, Ramya Harika. It was really a wonderful speech. And after the first round, some salient features. Dr. Mumta Singharam got inspired in 12th standard by a periodontist, joined BDS. She got inspired by oral surgery department, joined OMFS, and her speech also was really inspirational for, I think, everybody. And coming to Dr. Surajit Datta, he left home all the way to join in our college. because he was attracted to the ambience of the discipline in our college. Dr. Aisha, inspired to manage the oral cancer, joined oral pathology, and Dr. Arvind excellently combines the patient psychology with the treatment, and he is a successful private practitioner as well. Coming to Dr. Ramya, she is inspired by the Department of Oral and Maxillofacial Surgery, by the staff and the teachers. Surely we are all inspired by our teachers. If not for our teachers, we are not what we are. Yeah? So we'll go to the next round. That's Progen and Foresight in Dentistry. I would like to call upon my first speaker, Dr. Mumta Singharam, to talk about the present generation and what she sees herself in the future in dentistry. Please, Dr. Mumta Singharam, your views.
Yes, sir. Thank you. So yes, the present generation and what looking forward in the future about dentistry. So yes, as we all have spoken, the vision is something beyond your imagination. The present generation, everybody, they are still not aware. They're still not aware what we are capable and what all we can achieve in dentistry. So as Ramya mentioned, it is something really good. It is a healthy practice for you to always go and visit the choice of college that you want. So not any particular college to specify, not even, I wouldn't even specify any college in precise. Please do go visit and then find out what you would like to do. So there are many campaigns, there are many canvassing going on what dentistry is about and everything, but still people are really confused and they do not know the amount of work that we have to put through. So there is a view like dentista, palla, just the study to teeth. It's a very stereotypical thinking, which even as a dental graduate we had. So I'm not blaming the society for giving such a insight about dentistry. So as a student, as a person who wants to pursue dentistry, I think you have to go and find out what it is like and what you will be able to do out of it. The present generation, yes, they've speaking of the pandemic, they are not able to get any hands-on kind of a practice. I'm telling you, dentistry is something that you can do hands-on with anything that you have right now in your hand. Okay. So for the first 3 years of your dental life, you will not be given any patients. No. In fact, you will not even be sent to a clinical department. They will call the final year undergraduate student or only the intern to go inside the department, inside the clinical setup. So that is the amount of training that we have. So certain people will think, why do they restrict us? Why do they restrain us? No, it is not like that. There is a curriculum, there is a proper protocol where students are subjected to each and every step before they go and deal with the patients, because it is no joke. We would never try, because dentistry, like anything you do inside the mouth is going to be like really painful. So, and more than pain, I would say the fear of the patient, and Dr. Arvind should also explain about this. So the pain that you have on visiting a dentist is something really huge, and no one should mess with that. So this is why we are not allowed to treat patients till our third year, understand what it is and how it feels like to work on a patient, and then go about treating a patient. And looking into the future, there's so much of technology that has pumped in, and I'm not the right person to talk about general dentistry and its advances, because I myself have to learn a lot about general dentistry. When I come and I ask my peers, my consultants, I ask them what do we do for this? They speak way beyond, and they give us an insight saying anything is possible. Your broken tooth or lost tooth, the ways to replace it, the ways to rehabilitate a mouth has come a very far way. But the future, how do we link ourselves with medical professionals? That is what I'm going to emphasize about. We might have as a public or as a dental graduate, we will not know how to communicate with MBBS or medical practitioners per se. So about that, always select a college, okay, which has medical backup, medical facilities. So Dr. MGR University, we have both dentistry and medical. So we have Thai Mugamike Dental College and ACS Medical College. So for us, it was very easy to understand how a medical setup works. So we were just not subjected to dentistry. We were asked to go to the medical college also. So when we went there and when we got in connection with the medical practitioners, we understood how it is to work under a medical setup along with MBBS and MS, general surgery, radiologists, everybody. And since our college is also well equipped with medical facilities, it was really very helpful. So once we stepped out after our masters, it was not difficult for us. It was definitely not difficult for us because we weren't blank to go and communicate to any medical practitioner. So we had the knowledge on how to deal, what could happen, what could possibly go wrong, and how do we go about approaching. Like we had a set of examples, training. So that was the amount of thing. So the future. So moving further into it, my goal is like to be one among the peers of a medical or of a hospital. So we might think dentist clinic, no, it is not like that. My future, like the way after you join masters in oral and maxillofacial surgery, it doesn't stick under one roof. We needn't have to stick under one roof. That is what I'm trying to say. Yes, it is your personal choice to own a clinic or not, but my choice was to well further, like to reach further in, like till what level I can reach. So that is what prompted me, or that is what told me to get inside fellowship. So once I've come here, my goal, my role is, I am not associated with a maxillofacial surgery unit. So I am associated with plastic surgery unit. So the amount of exposure is, I go now dealing with hand and legs. So from 32 teeth, tongue, everything, now my exposure has been reached, is going to the extent of limbs, extremities like hand, leg, and everything. So are we allowed to do that? Of course, not in a private setup. You're not legally eligible to do that. But I have gained the confidence that tomorrow, as I'm a trauma surgeon, tomorrow, if a person is going to be meeting a casualty and like I'm going to operate them, it will not be a special case just pertaining to face. So they will have injuries in hand and leg also. It's a polytrauma kind of a thing. So at that moment, I would not panic. So as though they may call me a dentist or anything, I would never panic because I would be prepared, I would be alarmed, and I would be aware of what to expect and what not to expect and whom to approach. I think that is the most vital thing in a learning, on whom to approach for help. We should never restrict ourselves or think, why should I approach them? Or should I approach an orthopedic surgeon or a plastic surgeon for this kind of injury? So this is the training that you need to attain to know whom to call for what. So this is the amount of future that we have that is like pertaining to practice. So what all can we do? With the amount of technology, we can do reconstructive surgeries, that is ballistic injuries or simpler solenona cancer. So you have facial cancer, oral cancer, and the person has to go through a phase where he's going to lose his jaw or a part of the face. So we just cannot leave the patient like that. We need to reconstruct and bring back him to at least a near normal situation. So under that circumstance, how do you manipulate or how do you project the normal side face to an abnormal side face? We have 3D technology, we have advanced technology, and patient specific implants, PSIs, and also virtual surgery planning. That is, we just a small experience, like I had a patient where there was a total loss of function in his right side of face, and he was clueless on how to go about and bring it back to normal. So we told him that he has to undergo surgery and he has to undergo nerve corrections to get back his function and everything. He was okay. He was like, doctor, do something so that I get my face back. But we are not magicians. We don't perform magics. We perform proper calculative surgeries. So when it comes to that, you have to take aid of the present technology. So we went in for 3D planning. We went in for reconstructive surgeries. We did a model surgery. So that is like, you print the skull of a patient, that is a present situation skull of a patient, and then you mimic that, you operate on the patient outside, in front of the patient too. You can do that. So you just operate on a plastic kind of a material. Okay, so you operate on a skull and give them the desired result. So when you bring that result and show it in front of them on the table, so imagine the amount of knowledge that you're giving your patient and the amount of trust you're gaining from your patient. So after that, the patient wanted to go for the surgery because till then he was very apprehensive. He did not know what we are going to do with his face. That is something that is going to be there for life. So after he saw that surgery perform and what is the possible amount of outcome we can give him, he was really into it. So this is the future. So you must also be aware of what future holds, and you must know what to do and what do I say, like how to perform such kind of surgery. So you need to seek yourself or move inside or travel along a path where you are equipped with technology. So this is the amount of this is the immediate future that I saw after completing my post-graduation. So just out, and I was able to perform a mock surgery for a patient and gain his trust and perform that surgery. It was not an easy task, but it looks very easy. It feels very easy because of the advancement that we have reached in the field. And so this is the amount of advancements that I'm facing here in surgery. There are also advancements which Dr. Aisha would enhance on, like the stem cell therapy and everything. That there's so much, there's no limit. So as I've already mentioned, it's an ocean. Like, till you are tired, I don't think there's any stop. About there are so many fields. I've already mentioned that about cancer and everything. So Dr. Shakil can also give you an insight.
Dr. Mumta, sorry to interrupt you. You were talking about the model. Were you talking about the STL model?
Yes, sir. The stereolithographic models. Yes.
Very good, very good. And nowadays you're doing surgeries on stereolithographic models, is it? You're doing a mock surgery.
Yes, sir. Yes.
And you're showing the patient the outcome.
Yes, the
projected outcome. Can you elaborate a little on it? Is it done in the hospital, or it is done somewhere else?
Okay, fine.
How much time does it take? Can you elaborate on it a little?
Sure. Okay. So yes, so that will be the next question, definitely from the patient. No, when will I get my surgery done? So that is the pressure that the patient puts on us. It is not wrong. It is definitely his problem. Only when you are in his pain, you can understand that. So how the process goes is like, you need to go in for a scan, a 3D facial bone scan in a particular format called the DICOM. So once you get this, the CT film or the CT pictures will be uploaded to, there are many centers. I do not want to mention the centers. There are many centers who does this work. So you can upload your CT images to that center, and you can request that center to produce a model. Or you can also tell them like, and it holds a cost. So that model holds a cost. So, and you can explain the patient that when the model venona, you will have to pay the cost. So if they're not interested to get the model in hand per se, then the treatment compromises, meaning like the understanding level for the patient will compromise because they'll be seeing it only on the monitor. So you can project his skull, and if they need a model, you can make a model. So as Sir told, it's called stereolithographic model. It's made of acrylic. So they will have scans like CAD camera. So they will be making models, and there'll be a skull in your head. I'm so sorry, I do not have one right now. It's down. So they will be like showing you how your facial skeleton is. Other namblala we cannot see. Namblala paaka mudiyadhu. But on the model you can see. You can see how your face is. You can touch your own skull, but in a graphic model kind. So once you get that, it will take 2 to 3 business days for you to acquire that model. So once the model is come, your doctor, your surgeon will perform the surgery and maybe give him a day so that you will see what is the maximum expected result you can get. So there can also be 2 models that can be made and 2 plan of surgeries. So you can attain results. You'll have multiple ways. So if you want to attain something, there's not just one way. You have multiple ways to attain. So similar thing apply throughout your life. So even for surgeries, for attaining a near normal situation, you have 2-3 plans. So you can perform all those, and whichever the patient wants, you can give the patient the choice of what treatment you want. So that is the most beautiful thing. And once the patient I feel this will be enough for me, or I want this much of enhancement, doctor. Abdina, you can always choose what the patient wants. Documentation. Working in hospitals, it is very, very important to document whatever you go through. The need of the patient, the complications of the surgery, the best results that you can attain from a surgery, everything, the pros and the cons of the patient, of the surgery, of the treatment that you have decided should be documented. And you can get it. And then once the patient goes through a series of blood investigations and everything, and then the surgery is performed. And you can take a post-operative, that is like after the surgery, you can again take a CT, sorry. You can take a CT and you can tell the patient that whatever we have performed outside has been achieved inside. So in this, there is no hide between the patient and the doctor. There's an open rapport, open connection. So it takes almost a week, sir. So if that is what people want to know, it will take at least a week, and it is possible. And we do not do it for everything. So it is really not needed for a simple surgery, but for complicated surgeries where there is a gross deformity of your face. If you need to bring back, that's a ballistic kind of an injury. So if you need to bring back a little near normal situation, cancer surgeries where they lose their part of face. So அந்த மாதிரி இருக்கும்போது you can always go in for advancements like this.
Especially for orbital corrections and all those stuff, I'm sure it will be helpful. And this STL model, I'm sure, will gain the confidence of the patients.
Yes, sir. Yes.
So thank you so much. It was wonderful speech by you. Now, I would like to call the next panelist, Dr. Surajit Datta, to speak about Progen and future in dentistry. Please, Surajit Datta, Dr. Surajit Datta.
Hello, everybody. We sculpt smiles as a dentist, as a prosthodontist. We sculpt smiles through. My voice is audible, sir? Yes, fine. Okay. Yeah. So we sculpt smiles through art and science. Okay, and this has to be achieved with a lot of perseverance and patience and hard work, and of course the knowledge. Okay, and on the other hand, success in any field comes with the how well you understand the concept of learn, unlearn, and relearn. Okay, this is the funda. I feel that the success can definitely come when you understand the concept of learn, unlearn, and relearn. Okay, coming to today's topic, that is the second part, especially the foresight. Okay, for me, trust me, like foresee the dentistry, it's very difficult. But what we can do is, present, give your best. Uplift yourself, upgrade yourself, and and you can invent anything, and you can do good to the dentistry. Okay, again, on the other hand, with come to the updates, you, as I told in my previous session, like you go to the journals, the updates are there in journals and there in your articles, where you can search and you can upgrade yourself and think something new. What we can do from that, so apart from that, what we basically instruct our students and other people, that how can you evolve out of getting idea. You just have to get an idea what the researcher has done in a subject, and then incorporate in you, understand the subject, understand the concept, and think as much as you can, and give you 100%, find something new. That's how I feel the future is. Okay, and I want to stress on the topic that learn, unlearn, and relearn. That is means once you learn something, okay, it is not going to be permanent. Again, when new research comes, then you need to again unlearn yourself and relearn the new concept, because that's how a person evolves in any field. I feel, not even dentistry, in any field. That is what the pursuit to keep learning. Okay, and without any further delay, I want to just tell about the topic of today, that is the Progen and the Foresight. Certain important subjects and topics which I have found is like, artificial intelligence. Okay, there's a very emerging branch now which is coming to dentistry, and I believe in no time, even it might be incorporated in the dental colleges as a subject called artificial intelligence. Okay, because with the help of artificial intelligence, lot of data we can store in a computer. It's artificial intelligence, nothing. It's like human like behavior with the help of in technology and machine. That is what the artificial intelligence is. It is like the computer, you're developing a computer system which behaves like a human being, might be even a data storage, okay, or might be a robotics. Okay, this is what the future is just lying in our hands. So people are diverting themselves to understand this science of robotics or the artificial intelligence. It makes the work of a dentist so easy, like, the patient communication, and especially the radiologist. Even when data is stored in your CBCT and MRI scans, the computer itself will tell you the point of interest to be highlighted by the radiologist. Okay, so this is what I wanted to emphasize in today's forum, is that you please go through, when you go home, all of you, when you go home, please go through the artificial intelligence and the future where it's lying in the artificial intelligence. Okay. Second, which I want to emphasize, is the patient and dentist repo or relationship. That is the PDR, which I find the core in developing the clinical practice. Okay, a lot of us get confused, like how to handle a patient. First of all, in the clinic, when the patient comes to the clinic, the dentist thinks a lot of things: how to tell, what not to tell, what to explain. I just keep it simple in my practice, is like, just tell what the patient needs. Don't tell what you want. Just tell what the patient needs and what he has visited for the clinic. So this is what the patient dental relationship, what I've learned from the college and from the ma'am and other staffs, is do an ethical practice. Ethical practice will never put you down. Okay, that's what I believe personally as a practitioner, as an academician, that once you go with an ethical practice, then the patient also understands and accepts you as a dentist to be treated. Because first of all, as I believe, that you should have a gratitude that the patient has chosen you as among all the dentists, has given himself and allowing him to treat. So you should do an ethical practice to grow your practice and make him understand what he requires in a dental clinic, what the problem he's facing with the tooth. You just tell even the new techniques and even the older techniques, and let the patient choose what they want. And what happens when you develop this patient dental relationship, that PDR status, once you keep on increasing, and believe me, once you start practicing, this PDR status keep on increasing. One patient gives you 10 patients. That is what with the repo which you maintain. Okay, and once you grow up as a clinician, like that, once you explain the patient some treatment plan, the patient blindly gonna trust you that my doctor is correct, because he's an ethical practitioner, and whatever he's gonna do is gonna do for the welfare of my family. So that's why, because unless and until the patient gets the confidence in you, the patient will not accept any kind of advanced technologies and treatment modalities which you keep in front of the patient. That is what important is. Please do a very good homework on your PDR status, as patient dental relationship. That's the core, I feel, once you want to success as a dentist. Okay, coming the other things which I want to one of the most important thing again is the dental insurance. Okay, dental insurance, which I feel as in abroad is there, I don't know, is there not there in India, but it should be the future of dentistry. Because see, when you are equipped with a lot of knowledge, with a lot of skill, a lot of interest to do for the patient or the welfare of the patient, but if the patient can't afford, okay, because the whole amount has to be borne by the patient, because he is not insured by any of the company. So once the patient get insured by any of the company with a very bare amount of premium, so definitely he will not mind spending on dental treatments. And once the patients can afford the higher grade of treatment, you are delivering a very good amount of treatment and the advanced technology, because once you are getting that kind of patient, you can incorporate that in your clinic, the advanced instruments, such that because the patient is going to afford it, whatever be the price it was. So that's what I want to request all of you, being the future dentists and those who are dentists, please incorporate the dental insurance in our clinical practices, that the patient can afford all the treatment modalities given by all the specialists in the treatment, whatever required, what's the best treatment we can give to the patient. Okay. The other thing which I want to emphasize is the forensic odontology. Forensic odontology, in that there are specific subjects. Forensic odontology is there, in this dentist field from long back. But what has come up is the cheloscopy and the palatoscopy. Cheloscopy is nothing but you get the people's with a lot of research, they found that the lip prints are identical for each and individuals. Okay, so what the forensic odontology do is they study on the lip prints of each and every individual. Or lip prints of all the individual, and it is found to be very identical. It is found to be very identical with, and they can identify the person with lip prints. Even it has been used for even the in any kind of crime. So that is what again is emerging is the forensic odontology, where cheloscopy is one of the very interesting topic which I want to highlight today, is that they are growing with it. Okay, coming to another aspect is the dental hubs. Dental hubs is what we lack is, we are scattered. We are scattered. We are scattered in giving the treatment to the patient, because the patient come to us. They suppose he wants to do the root canal treatment. Okay, then we have to call an endodontist. Then again, you have to put a crown. You have to call a prosthodontist. But what I want to emphasize is that why can't we create a dental hub where, and it's not a chain of dentists, which I just want to emphasize. It is dental hospital where we can deliver all kind of dental practice under a single roof. Coming even might be in endodontics, might be prosthodontics, might be oral maxillofacial surgery, removing tooth or impacted tooth. So what's the benefit the patient get is, at a single go, on a single visit, all the treatment is done at a single group. The patient is happy, we are happy, and the dental treatments and the faith of dentist over the dentist grows over time. Okay, so these are the important factors which I want to today want to highlight. With artificial intelligence, the PDR status, and of course there are other fields also there, like laser dentistry in endodontics. Okay, but right nowadays laser has been used to disinfect the pulp. So this is another growing subject. Then another one subject in prosthodontics is the graphene. The graphene is nothing but it's like a thin layer of graphite. Okay, which is now it's like emerging in the kinds of implants. It's a it's a blessing to implants because of flexural strength and the flexion strength, and it has a shock absorbing capacity, which takes a load from out of the body to the implant, to the bone. And that's what is, and it's a really amazing material, the graphene, which is now introduced to the industry, and it has been flourishing so much. So this is what I want to conclude with, that please go through with the artificial intelligence, evolve yourself in artificial intelligence, evolve yourself as maintaining the media status. Okay, and of course dental insurance is an important development. And of course, one more thing I just want to emphasize is the CAT camps. CAT camps, of course, is there from long time, but it's not because we are upgraded to a higher technology. Patients are so much updated, so much. The patient wants a crown in half an hour now. So it's within no time I can find that the casting will get eradicated in 10 or 2 and 1 or 2 decades. And what we will left out will be all CAD/CAM machines where the crowns is fabricated just in few minutes, and the patient just crown cutting is done, intraoral scanner is used, and the crown is ready, and the patient goes with the crown. So in many standard clinics and many good clinics now it's practiced, but yes, it has to be done. It has to be practiced in each and every clinic. And hopefully I believe that in future practice, definitely it will be done. So with this, I conclude my today's session, and I hope I have given some kind of ideas to all of you that regarding the future of dentistry. Thank you,
Dr. Surajit Datta. It was wonderful listening to you. Just like to ask one question. You were talking about PDR, that is patient dentist rapport. How important is it to take a consent? And what type of consents will you take from the patient?
Yeah, actually, one more part. Yes, we need to aware ourselves with the medical legal issues, which is growing. Like I practice in Pune city, so patients are aware and ready to sue you anytime once you do something wrong, or even might be right but might be wrong in the patient's eyes. So things might go haywire anytime in your clinic. So you need to be secured. It is for safety of all dentists. We need to have some kind of knowledge about the medical legal issues. So there's an informed consent. You are telling the patient that this is what I'm going to do with you. And I've explained to you everything, and I'm getting your consent done in front of you that if something goes wrong, please accept it. That is what is informed consent is it's not my fault. It can happen. It's just a medical emergency. It's not an error, dental error. So when you have a medical consent done, you have a shield. It works like a shield to you that you are protected legally, that the patient will think twice to go for once you show that you have a consent with me, that I have taken your consent. So what I even practice in my clinic is when the patient come, let it be even smaller to smallest treatment, or even let it be a filling, or let it be anything. Please take a medical consent from the patient, because you are secured anytime, especially for the implant and all. Definitely you should take medical consent, but that's very important. So, when you develop a rapport, and even the patient appreciate it, because you are updated to even the medical legal issues which is happening, and which it might.
Thank you so much, Dr. Surajit. Dr. Surajit, thank you so much, Dr. Surajit Datta. It was really informative. The speech was really informative and inspiring. Thank you so much. I would like to call upon the next panelist, Dr. Aisha Tabassum, to talk about Progen and Foresight in dentistry.
Thank you for the question, sir. As after finishing my BDS, I was, as usual, quite confused and maybe with the different thoughts. I was sure to do masters, but what will be better option for me? Because choosing this masters will give a way for next 20 to 10 years of my life. So what I should be doing, which I am so happy with it. So I was, one thing was sure that what not to do, and I was clear with what I should do. So what not to do was easy to sort out, and what to do was, like, as I was interested in forensic odontology and research, which was experienced in internship, and there is one reason I understood in India was because of the oral cancer, the fastest increasing rate of oral cancer, which is the third most common cancer in India. It is this major problem can be prevented by early detection and offer the best chance for an individual to survival. And to survival, we have to give the patient a definite diagnosis. That definite diagnosis can be given by an oral pathologist. So oral pathology, as its uniqueness in its own, this is the only specialty I took because it forms this bridge between the dental sciences and also basic medical sciences. So the person, the individual who is willing or interested to study oral pathology should have a research mindset and should have interest to know something new and always be open to innovation. And so that in oral pathology, you can explore a lot of thinking abilities and can do research out of the box. MDS oral pathology has given a new pathways to opt for oral healthcare research activity, very particularly. And there are many advanced courses in oral biology, genomic technologies, and nanotechnologies. If anyone is confused what to do after specialization of oral pathology, so very first thing, here you have very multiple areas where you can be employed as consultant in dental clinic. You can open your own oral pathology laboratory, and you can be a quality manager in the diagnostic laboratories. Also, you can be hired as an oncohistopathologist in the oral cancer and the cancer institutes. You can be work as a consultant in dermatologist clinics and can be eligible to be an editor in the national and international journals. Last but not the least, you can be an academician to teach the basics foundation of dentistry to dental students. And also an MDS oral pathologist is always open to have their own practice. Along with the oral pathology, forensic odontology is an integral and important part of this branch, where we could work in a forensic laboratory too, to help in identifying a person's identity. As we all know, there are Delhi incidents. The Delhi incidents was given by a major forensic odontologist only, by the individuals by bite marks. So the case was concluded only because of the irregular way of teeth the individual had among the persons who did that. So the forensic odontology's power has been improved after that incident, and there are many courses the Dental Council of India is trying to give and to certify the doctors after doing the BDS. Also, we can do that, and also if we finish MDS, there are many more higher positions to be, work on forensic odontology and normal forensic labs. To me, oral pathology, sky is the limit. The seed thought of doing this oral pathology was given by Dr. MGR University and Thai Mogambique Dental College, and I'm thankful for it. Thank you, sir.
Thank you, Aisha Tabassum, for that lovely enlightenment. I would like to ask one question. Your CV reads about entrepreneurship in dentistry. Can you elaborate on it, please?
Yes, sir, sure. Being a medico, this entrepreneurship and business was very new and interesting too. New, but entrepreneurship and dentistry, I understood the power of idea. How an idea can be made into a product, or how an idea can do things. So being in a dentist, major thing we thought of doing was to create a dental paste, to formulate a dental paste and dental hypersensitivity. Alhamdulillah, we made a prototype in the Abdul Kalam Research Institute. So entrepreneurship paved way in a broad aspect. I thought only after finishing dentistry, entrepreneurship was new and business was new. So after finishing dentistry, I thought clinic or masters, this only is there, but no, an idea from any profession, very importantly from our profession, there are many good ideas which can be implemented, and we are in need of that. So if we work both on entrepreneurship and in dentistry, there can evolve many instruments and many ways of treating patients. So yes, thank you.
Sorry, thank you so much for enlightening us, Dr. Aisha Tabassum. Our youngest panelist has really enlightened us. So coming to the next panelist, Dr. Arvind Chakravarti. You can share your thoughts on Progen and Foresight in dentistry. I'm sure you have lots to share.
Okay, sir. Without any further delay, I will move up into the title, Progen and then Foresight in dentistry. We have heard about the overproduction of dentists, and dentistry is already attaining saturation. But I have seen many successful dentists and those who are paid in huge amount. The scope is always depends on our own interest and skill and our own goal. I would like to tell what after BDS into two categories. First one, further studies. First and foremost option is to attain MDS, but you can join college only by the qualifying entrance examination like a NEET, AIMS, PJ, etc. Other than MDS, we have plenty of options according to our field of interest available in short-term and long-term diploma and fellowship programs also. And then another one is practice. In this practice, first, I would like to tell about working under the experienced doctor or in the reputed hospitals or in the corporate hospital. By working under someone, there is always a less risk and no investment needed. But we can get the experience in how to manage a patient, how to talk with the patient, and then how to administrate the clinic, and then how to manage the finance, and many more things, which things we can learn only by ourselves from the experienced one. After getting some experience, we can set up your own clinic with some clear-cut clarity. The beginning may be lag, but there will be a hike when you get good at it. The success depends on how well you do your job and how focused you are. Ultimately, it is not about what is the scope of any degree, but the interest and skill matters. Dentistry is the highest earning profession in the worldwide. As any other profession, BDS graduates too can make more money provided we follow the basic business strategy and professional ethics. Believe this is always a scope. Believe there is always scope if you are good at what you do. Rome was not built in a single day. Nothing will happen in one day, but one day it will happen. And then nothing is big or nothing is small. You just have to be on the top Otherwise, everything will be nothing. You have to be calm, stay focused on your goal as an eagle. And then remember this, more you learn, more you earn. Consistency matters. Finally, I believe we are not job seekers, we are job creators. Thank you.
Thank you so much, Dr. Arvind Chakravarti. I just have a small question. You are trained and you are practicing patient-specific implants. Can you just elaborate briefly about patient-specific implants so that it will be enlightening for every one of us?
Okay, sir. There are so many types of implants. Like for the full mouth rehabilitation, the first and foremost thing, we are going to all on 4 or all on 6 or all on 10. There are so many options available. And then basal implants, cortical implants also, that will be in maxilla, there will be 8 to 10 implants minimum. And then in lower also 8 to 10 implants. When compared with these implants, this is very, very recent one, but it is more innovative one. And then this is very, very a simple technique. If there is any fracture in the mandible, we used to we use the
mini plates. Okay.
We used to do the plating. So like that plating, there is some elevation like implants. Okay. On top of that implant, we are getting one metal frame and we are providing the denture, over denture. And then it will long last. When compared with the normal conventional implants, the pressure will go one side the implant through the cortical bone or something the osseous bone. When compared this, it will be going into the osseointegration. Like the fractured one, it is the titanium plate. Definitely the area of coverage is more when compared with the other one. And then it is more economically when compared with the all-on-4 or zygoma implant, whatever it may be. Other than the patient-specific implants, it is a most economical one, and this is the cost-effective. And then after our 5 or 10 years, we just have to replace only the acrylic teeth alone. And when compared with the all-on-4, all-on-6, everything, the amount we are spending is very less, and then we will get the prognosis is very good.
Sorry to interrupt you. Is there any special armamentarium required to place this implant? Is there any special armamentarium required to place this implant?
No, sir. It's very simple. When compared with the other implants, we don't need internal kit also. The first of all thing, we have to take a CBCT of upper and lower jaw, and then we will get the PSI a stent, and then we will get that bar, and then we will just open. It is very technique sensitive when compared with other implants. It is very invasive surgery, and then we have to keep the stent, and then we have to place in the jaw according to that marking, and then we have to screw like normal titanium plating.
And STL models do come into play in these areas. I mean, in this field.
Yes,
so STL model adaptation and all will give you more precision.
3D printing.
3D printing. That's what STL printing. Thank you so much, Arvind Chakravarti. It was wonderful listening to you. I'll move on to my next panelist, Dr. Ramya Harika, to talk about Progen and Foresight in dentistry. I'm sure she has more views on it.
Like everyone has mentioned, there are a lot of advances in dentistry, right from our diagnostic tools to the procedural tools or the equipment we use. So for anything to learn anything in the advanced end, and I wish everyone should know the basics of everything in dentistry and then proceed with the advanced technology, because at any time, at any advanced technology you use, if in case it fails, you must always know to back it up with your basic knowledge in the dentistry or in any procedural field as that matters. For example, you can take the local anesthesia itself. You have to know the conventional, the regular way of giving a local anesthesia before using devices like the computer-aided delivery device or anything for that matter. You can take the TMG, for example. There are a lot of arthroscopies, arthrosyntheses which are available. while doing an arthroscopic surgery for the temporomandibular joint, you must know how to do a conventional surgery, the open method of doing the procedure. You must learn the anatomy of the temporomandibular joint region before going and attempting an arthroscopic surgery, because at any point of time, at any difficulty you face, it is always the basics which help us in navigating further. So always be strong with the basics, learn the basic anatomy and physiology. Especially when it comes to oral surgery, anatomy plays a very important role. Without knowing that, we cannot implement or learn any advanced technology. We may move up to patient-specific implants for orbital reconstruction, but the basic dissection of the orbit is always conventional. It is always the standard way of dissecting and approaching the orbital floor, reaching the orbital floor fracture. Only then you can place either a conventional implant or a patient-specific implant to get better results. But knowing how to reach about the dissection, reaching the orbital floor fracture or a mandible fracture, or it can be your tooth extraction as well. There are a lot of advancements in forceps, the physics forceps or Bennett's extractor, or a lot of devices have come which will aid us more and make it comfortable for us as well as the patients, with the minimal discomfort and as comfortable as the procedure gets. But if in case it fails, you must always know to conventionally extract the tooth by using your regular method. So I would always advise people to learn, perfect their basics, and then go about to learn all the advancements. So there is no harm in learning advancements in all the fields. After BDS, you can learn the advances which comes in all the departments, like all the others have mentioned, the advances in prosthetics, the AI technology, like Dr. Mumta told, the patient-specific implants which pertains to oral surgery. As a general practitioner also, there are a lot of diagnostic equipments, like now they are eliminating the impression materials itself and using the scanners, the digital scanners for taking impressions, like how it is with the patient-specific implants and the stereolithographic models for the surgical side. The prosthetic team has also come up with all the newer technologies. So before you upgrade to the newer technologies, please have a knowledge of the basic way, the conventional method, and go about with learning any other new technologies in all the field possible. Thank you.
Thank you very much, Dr. Ramya Harika. It was really a wonderful speech. I would like to request the audience to pose some questions for my enthralled and compassionate panelists. They are willing to answer any questions. Please post your questions. Otherwise, I may have to give them the tough questions. Thank you so much. So about this round, some of the salient features I would like to read about. Dr. Mumta Singharam spoke about stereolithographic model, and she also spoke about how stereotyping is being broken away by her achievements in her life. That was really wonderful. Dr. Surajit Datta spoke about many things. So he spoke about dental hub treatment, about graphene in implantology. He emphasized on artificial intelligence and robotics. He also emphasized on CAD/CAM technology, which will be a chairside manufacturing of crowns. The patient will get the crowns and bridges done in chairside itself. And building up dental insurance, chilioscopy and palatoscopy. Excellent it was. Dr. Aisha Tabassum was very much interested in oral pathology because she was interested in diagnosing the oral cancer and she was interested in preventing it. And she is also interested in oral pathology because it's a research-oriented field. Excellent. Dr. Aravind Chakravarti, who spoke specifically about patient-specific implants, is doing very well in patient-specific implant, and I wish him all the best. Dr. Ramya emphasized on the point of being strong, reading your anatomy and physiology, and being strong. It is a very true advice. It should be followed by every one of us. Now we'll move on to the third round, which will be a question and answer round. So I will pose the question for each of my panelists. So starting with Dr. Mumta Singharam. So Dr. Mumta Singharam, how do you see yourself in this craniofacial trauma and what inspired you? I have 3 questions to ask you. So what inspired you to be a craniofacial trauma? Well, you know that OMFS is a large field. You have trauma, you have cleft and craniofacial surgery, you have onco, you have implantology, and so on, cosmetology also. So what interested you to become a craniofacial trauma surgeon? One. And second thing is, where do you see yourself? And third question is, how competed are other fields into this field? And how do you plan to manage in future?
Okay. Sir, moon question. Okay. So how did this start? Like I mentioned, when I joined my undergraduation in Mogambikai, the very first CD program, continuing dental education program that I attended was craniofacial. I do not remember the name to be very precise, but it was something pertaining to craniofacial surgeries, that is osteotomies or craniosynostosis procedures, that corrective procedures that were being done on children, on infants, to be very precise. So that is what really inspired me and told me, like, is this even possible? If yes, then I want to be a part of it. But as the reality hit, I thought, okay, let us try to venture into other fields of dentistry. But again, my beloved department helped me pursue the dream. And here now I'm in a craniofacial unit, assisting. For now, I'm assisting, yes, and I do operate. But where do I see myself? So everything starts from basic learning. So what I am doing, and learning is something, so once you are a doctor, learning is something till your deathbed. So there is no stopping you from learning, and every day is some knowledge gained as a doctor. So yes, I am learning. I'm learning to the extent or to the level where I see myself as one of the craniofacial surgeons who will be able to operate on children with special needs. And my focus is more on trauma and cleft. So cleft children are, yes, there are still a huge number of cleft children where they call it as hair lip in a regular term. When the lip is split or they cannot talk, because a child which is born with a cleft anomaly has to be dealt till his or her 17 to 18 years of age, going through various surgeries. One is to improve the looks, one is to improve the speech, one is to improve the behavior, everything. So once the child is being put through so many surgeries, I would like to be a part of it, treating a child till he's he or her is completely fine with what they are. So that is the future I see. There are many non-governmental organizations who really help the children in such a state, and I would like to be a part of them, so that I would be able to start my own unit. Or even if not, that is like the wider vision. Even if not, I would not be I will not let down my hope, or I'll not be demotivating myself to stop. I would always join a unit which helps or supports children and patients of such large extent. So I would like to see myself working with other medical practitioners, and I wouldn't call ourselves any different. We all fall under the same roof because our only goal is to cure the patient. So with that perspective, with that kind of aim, I think we all fall under the same roof, and there is no differentiation of a dental practitioner or a medical. We are all under the same roof with one goal of treating the patient right, in a correct manner, to gain for the patient to gain his or her confidence back. So trauma is something which is inevitable. It is an accident, that is all. So we never expect any accidents, and when it happens, we must be really ready and equipped. So a lot of patients, which I clearly lack, and I'm gaining right now because of the amount of patient cover I'm going through. So a lot of patients, a lot of lateral thinking, and a lot of interaction with your peers. So do not stop yourself, or do not restrict yourself from connecting yourself to another doctor, and choose right institutions, choose right doctors, right contacts, to spread yourself, to attain more knowledge, or attain more advanced, as we were talking. So where they do, what all they do, what all can be done for your patient, because ultimately our goal is one, to treat the patient. So do keep yourself, have inputs, please be educated, or please get trained. And trauma is something like, yes, it can be done in an emergency basis, but always follow protocol, because that is what my institution taught me. So go by protocols, go by stepwise management, do not rush. So that is where the patient plays a role, like you have to be really patient, because each step is very, very, very vital. As Ramya told, anatomy, understanding the basics. Without the basics, I'm sure it is very difficult to go through the next step. So please do get yourself trained and strong with your basics, and have a protocol. Even if not, there is an international protocol for every procedure that you would like to do. If not, create your own set of protocol and follow the steps, and so that the end result is beautiful. It's a discipline by itself. So the end result is beautiful, and you're doing help to the patient and not harm to the patient. So with that in goal, so these are the future perspectives that I would like to achieve, Dr. Shakil sir.
Lovely, lovely it was. And one more question. Now, how do you think that other fields will compete with your field? For example, this head and neck area has been shared by other fields as well. How are you going to devise a plan so that you are more competent to them?
Okay. Yes.
I know it's a tough question, but still, I think you are capable of answering.
Yes, it is difficult. It is a very challenging field, because ENT, plastics, we all share the same area. So what I would suggest, what I would really recommend my juniors is that work with them, be their student, learn from them. There's no harm. There's no hard and fast rule that you have to be the primary surgeon. It is okay to be the second surgeon in your initial days, because as days go by, they will become your students. Trust me, I have seen my seniors having ENT postgraduates as their students. So I do not feel any need or any competition that I have to be the primary surgeon. No, it is always work in harmony, work as a team. So without a team, I do not think surgery is ever possible. A team, it is not only comprising of other head and neck surgeons, but I would start from the OT technician to the OT brother, the anesthetist, even this worker of the operation theater is a team. You all comprise of a team. So if not, then I do not think the result that you decide will never be given to the patient. So there is no hard and fast rule of being the primary surgeon. It is always advisable to learn from another surgeon, no matter what specialty they have performed. And cleft per se is a highly shared unit where plastics and oral and maxillofacial surgeons are competing to be the primary surgeon. So I feel in such situations, always choose institutes or centers where they work as a combined team, so that you also have equal opportunity, they also have equal opportunity, and they might learn from you, and they themselves will also give you an opportunity to start your own center. So it is helping each other. You help, you're going to receive help. So that is how it will be. And there is no aggressive competition. It is a smooth sail, and always have teamwork in mind, so that you will reach your height in a slow pace. It's a very slow growth, but trust me, enjoy the journey. Be slow, be patient, be perseverant to see yourself achieve great heights.
That was a wonderful and excellent advice. Most probably all the OMFS peers or my juniors will follow this, I'm sure. As Dr. Ramya and Dr. Mumta said, stick to your basics. Always stick to the basics. Now we understand why our staff members used to give us seminars on physiology, anatomy and all. So once you become a staff member, only you realize the importance of the staff members and their seminars. So indeed. So next, thank you so much, Dr. Mumta. And next, I would like to call upon Dr. Surojit Datta. My next panelist, please.
Yes, sir.
Yeah. Surojit Datta, you already elaborated on dental insurance and artificial intelligence. So I would like to ask you how easy it is to get a dental insurance, and how should a practitioner bring about dental insurance in his practice, and then how can it be implemented very easily? This is really a noble gesture that even people who can't afford can get their treatment done, especially when implantology and other things are very costly. With dental insurance, it should be possible. Then we can claim that it's going to be teeth for all, and everyone is going to have a wonderful smile and they're going to have a very good mastication. So please elaborate on it.
Yes, sir. Being a prosthodontist, I always look for a person's smile and, like, rehabilitate the person's smile. But the sad part is it's very costly affair. Patient has to be really affordable, to build the smile, and as a full mouth rehabilitations and everything. So coming to dental insurance is a vast topic, and it's not one person, like, that should not be done by one person. It's not a one person job. It has to be like all we has to be united and make the association understand that really we require it. It's nothing harm. Like even like the medical field, they have done it, because whatever be the cost of the surgery, whatever be the cost of the expense the patient has to bear, they get it a minimum expense, a minimum premium. So for example, for 10 lakhs of this thing, insurance, the patient has to pay hardly barely 7-8,000 in a year, which is very less. Coming to this, how we can do this, how we can implement it in the dental practice is all has to unite. It is nothing that unless and until every of us unite and put forward strongly, even the association, the Indian Dental Association has to take it forward behalf of us. Like we need it for the higher practice, for doing it higher treatment morality, for giving excellence to dental practice, to uplift ourselves, to uplift, and for the welfare of the patient. We need to unite together and make a protocol, and shortlist all the kind of things which require to which can be covered by dental insurance, and the company can cover without facing much loss, or should not be trouble to even the company also, and should not be trouble to the patient also. So I feel it's all depend on the thinking process. All of us should think united. All of us should think in the same path, that yes, we should incorporate dental insurance, in our dental practice. That's what important, and simultaneously to grow your practice. You will flourish like anything, because you have no boundaries. You can treat anything you like, and like you can give it the utmost, the recent advanced treatment to the patient, because anyway you are paid for what you're delivering to the patient. Because many times our hands get tied, when suppose, for example, as a prosthodontist, I go for as a consultant, or and patient come to my clinic. Suppose a complete denture patient come to my clinic. So what I have to give all sort of treatment modality or treatment plan to him, right from a simple complete denture to implant support complete full mouth rehabilitation. The patient agrees till complete denture or somewhat to implant support denture, but the patient doesn't understand that I should go for full mouth rehabilitation, because that is definitely a superior treatment, and in future will prevent my bone loss and all kind of things. So I'll get all kind of I can do all kind of function, mastication, the chewing efficiency increases, the bone loss is hampered, my bone height is maintained. So that's, but my hands are tied because the patient doesn't accept it. Why? It's not wrong from patient side, because he also can't afford a big amount like this. So that's quite genuine. That's why we should unite. We should put forward this to the Indian Dental Association, and we should seriously look for it, so that we can deliver a higher treatment modality to the patient. That's all I can say.
Thank you so much, Dr. Surajit Datta. It was really enlightening. And next, I would like to call upon Aisha Tabassum, our next panelist, our younger panelist and youngest panelist, Aisha Tabassum. And Aisha, you have been inspired to manage oral cancer and diagnose oral cancer, and that's why you joined oral pathology. And what prospects do you see about stem cells and forensic odontology in future?
Yes,
do you think they can be a teeth grown in lab itself? Is there any research going on about it? Can you elaborate a little about it?
Yes, thank you for the question, sir. So as moving on to the first thing was stem cells. Here, after entering into the oral pathology, though I had a research mindset, how to do a research and how to select an ethical research which will serve actual something to the society. So that is the success of the research basically. So to organize my thoughts, to select what will be proper research took time, and it's because of and I'm happy that I'm placed in this department. So stem cells, we cannot constrict only with the dental. We can also do research with the normal cardiologist, other medical basic sciences. We can do a study on the cardiology patients who are having pulmonary problems, and research has become wide if we bridge both the dental research related to the general research, sir. So second is forensic odontology. Forensic odontology, though in India it has been very less, and people are not being aware of it. Only who have interest have finding the ways to pursue forensic odontology as a scope. But there are many opportunities. There are courses which gives us a degree, and you can pursue that in the forensic labs, also in the AIMS and Pondicherry Medical College and all. We can go and work there. They do take forensic odontologists, and forensic odontology is very important in police stations too. People who have finished forensic odontology, they can go and work in the government police stations and the police departments too.
You mean forensic department?
Yes, forensic departments. Obviously, forensic department is there in the police stations. So every police station has a forensic department. So you can, without hesitation, go and work there. We can give our resumes there. And research, talking about, there is a research in amino acid racemization, sir, where this has been done in archaeology too, and gave a much difference in forensic odontology too. They take the dentin layer alone and estimate the aspartic acid level in the tooth. So this aspartic acid level has been estimated by the HPLC. It will give a curve where it will give an estimation of an individual's death, how long the person has been died, and what was his age. It's only because of the aspartic acid estimation. The level of aspartic acid has been secreted in the dentin has given this study a very good opportunity. And most of the archaeologists are focusing on the forensic odontologist only, sir. As the bone is the only very strongest, enamel is the strongest bone in our whole body, they are more doing research and accepting the forensic odontology is in a very good manner. So we can also see through the face length, we can estimate the height of the patient, and the blood group of the patient can be estimated by the pattern of Rouget. And depending upon the lip prints and the fingerprints, there are research doing which will tell which birth month the individual is in. So that will close call to identify the individuals, no, sir. So it's blooming, sir. It's blooming. Persons who are interested in forensic odontology, I'll request them to please go ahead. And there are many colleges too. If you are want to be in a very higher position, do masters in
sorry to interrupt you. Is that going to be a subspecialty in your future endeavor?
Yes, super specialty. I would say, inshallah. I would say. So if you want really to be in a good position and to explore more in forensic odontology, oral pathology will be a good option where you can learn the tissues in a molecular level that will help you in forensic odontology.
Thank you so much, Aisha Tabassum. That was informative and wonderful. So next, I would like to call upon our next panelist, Dr. Arvind Chakravarti. So Dr. Arvind Chakravarti, you told you are already a diploma holder in psychology. So you have told that managing the patient as a whole. And how successful are you with the psychology and the patient?
Once we understand the patient itself, once we understand the patient need, or the way of speech, and then we can understand them, and then how they are expect, and then we can help them out with what their expectation is different from the non-psychological. Okay. So once they understand the patient's mind and their needs, definitely we can handle them, and then definitely we can convince them, and then definitely we make them understand what they are suffering, and then how they are suffering, and then what the condition exactly they have. Once they understand, they will definitely go for the better option.
Lovely, lovely. Thank you so much, Arvind. And I would like to call upon my last panelist, Dr. Ramya Harika. The question to you is, future prospects of oral and maxillofacial surgery. What are the future prospects of oral and maxillofacial surgery? Where do you see yourself?
Thank you for the question, sir. So right now it's been a year after, exactly 1 year after my post-graduation. So in this past year, as an oral maxillofacial surgeon, to practice the surgical part, that is the major surgeries, we need to associate ourselves with the team. So the team should comprise of at least one senior person who would be able to guide us and help us through the procedures. So it is to give an example. Earlier this month, me and my senior, one of our seniors who has done a fellowship in oral oncology, we had been to another medical college to perform an oncology procedure, to do an oral cancer surgery and a reconstruction, where the general surgeons, general surgery PGs learn from us oral surgeons. So it is not that one department is above or one is below, or the general surgeons are above us or below us. It is the skill that we learn that matters. So to learn the skill, you should be willing to go and be assisting someone, help right from the beginning. Like as an oral surgeon, we need to start seeing the patient right from the beginning, see them preoperatively, go and assist the surgery, and then see the patient, take care of the patient post-operatively until they are discharged, and follow care with the patient. So all this has to be done in, like Mumta said, there is a protocol to be followed, especially in oral surgery. So the future would be learning, again, like I said before, learning the basic procedures. For myself in particular, I would like to pursue further in orthognathic surgery. So for anything for that matter, everything is interlinked. You learn the basics of trauma. That is an orthognathic surgery which happens by nature, that is by accidentally which fracture happens. The same we do in the orthognathic surgery, we do a planned precision cut and reposition the bone and fix it in an aesthetic manner. So everything is interlinked. So I would see the future is learning, for me, learning the basics. And then there are a lot of developing technologies, like for oncology reconstruction, we are using free fibula bone graft, taking the bone from the leg and shaping it in the form of a mandible and placing it. But there are a lot of literature in the recent times saying that there are metal frameworks which come with bone grafts, which can be fixed in the jaw, which will eliminate the need for taking the free fibula graft. That is the one major procedure on the leg is eliminated totally, so that the patient need not have a functional or aesthetic deficit on their leg, and at the same time have a reconstructed jaw. So learning the future, as these are the latest advances which have come. And like we talked about earlier, the stereolithographic planning in orthognathic surgery, since I want to pursue more in orthognathic surgery, so the stereolithographic planning of the surgery, doing a 3D planning, doing STL models, and doing mock surgery on the models, and then performing them on the patients. So to achieve any of this, we need to work as a team. We need to work hand in hand along with our seniors, learn from anyone possible. Like Mumta stated, we work as a team right from the OT technician, the anesthetist, so we can learn how to manage at each step possible, because as surgeons, I'm sure Shakil sir would agree with me, we need help from all the people around us, right from the OT technician to help us achieve the proper position of the patient, to make sure the patient gets the drugs on time, to make sure they're shifted and brought back properly. The anesthetist who gives us a calm patient, a well sedated and well anesthetized patient, and a proper field for us to work in. And as well as the nurses who take care of the patient, we write the orders, we write all the drugs, the orders, what all to be followed, but it is them who meticulously follow those instructions and take care of the patient for us. So we have to work as a team, hand in hand, and improve our skills day by day, learn things as we go, keep learning, and that is how I think we can be a successful or a very good practitioner in oral surgery.
Lovely, lovely. It was a lovely speech, and you are emphasizing on being harmonious as well as living in harmony with all other fellow surgeons. Excellent.
Yes,
harmony is required. Lovely, yes. Lovely it was. And I have one attendee who would like to talk. Would like to ask a question? Would you like to ask a question? I'm not able to unmute her. Maybe it's time also to conclude. So unfortunately, I'm not able to unmute her. Padmavati Chittibabu. But anyway, so concluding remarks. All to Dr. Mumta Singharam, Dr. Ramya Harika, who are supposed to be my juniors, in the Department of Oral and Maxillofacial Surgery, have emphasized on sticking to basics. And of course, every panelist and everyone will agree that sticking to basics is always important. And from Surajit Datta, he was inspired by our college, and he wants the consent form, the both oral and written consent from every patient is going to save our art. And I second his thought about Aisha, about her future prospects in oral pathology. I wish her all the best. About Dr. Aravind Chakravarti, combining psychology with patient management is an excellent innovative thing. And about Ramya Harika, I've already told. Thank you so much, all panelists. Now, next, I would ask the next speaker to speak about, give the vote of thanks, please.
Thank you, Dr. Shakil sir, and all the panelists for sharing their wonderful journey and knowledge with us. We have posted the feedback link for attendance and certificate in the chat box, and I kindly request everyone to fill it. Now, Ms. Abhirami will be giving vote of thanks.
It is not the events in our life that shape us, but the memories that are attached with it that really does. And it gives me a great privilege to propose the vote of thanks on behalf of Thaimur Gambike Dental College and Hospital to all the delegates present here. And foremost, I would like to thank our founder chancellor, Dr. A.C. Shanmugam sir, our honorable president, engineer ACS Arun Kumar sir, and also our respected secretary, Dr. A. Ravi Kumar sir, for being the pillars of support throughout. And a vision without action is nothing but a dream. So I really thank our vice chancellor, provost, rector, and our registrar who made this event a great possibility and reality. And extend my thanks to Dr. L. Ramesh, the joint registrar for events and publication. Above all, I thank the luminaries for today, the speakers and the moderator, Dr. A.M. Shakil sir, and our beloved speakers, Dr. Ramya Harika, Dr. Surajit Datta, Dr. Aisha Tabasu, Dr. Mumta Singharam, and Dr. Arvind Chakravarti. And I would like to put forth our sincere thanks to our beloved principal, Dr. Einstein T. Burton, additional principal, Dr. M.K. Karthikeyan sir, and also our vice principal, Dr. Uma Sudhakar ma'am, and all the heads of departments, staffs, and the students for gracing this event with your presence. Things end, but the memories last forever. So let's hope to see every one of you together in person. Thank you for attending.
Thank you so much. It was lovely interacting with all panelists. I would like to take this opportunity to thank my department, my principal, my college, and my management. Thank you so much, panelists. It was wonderful. Have a good evening.
Sir, indeed, it was a pleasure to sir.
Thank you, sir. Thank you so much.
Thank you.
Thank you for the opportunity, sir. It was a pleasure to be coming back to our alma mater.
Thank you. Thank you so much. Thank you so much, guys. Thank you. Thank you, everybody. Have a good evening.
Thank you, sir.